Hello, and welcome to Health Matters, a show about the health issues and interests facing our community. I'm Gilda Kramer, your host, and I'm a Lower Merion Township Commissioner. I chair the Board of Commissioners Health Committee. Today, we're going to talk about gun violence, a health pandemic. My guests are Shawn Kramer, a licensed professional counsel with the Center for Psychological Services in Lower Merion Township. Shawn is the past president of the Board of Directors of Ceasefire Pennsylvania. Mike McGrath is the Superintendent of Police in Lower Merion Township. He has been with the township for 42 years. He supervises our outstanding police force of more than 100 officers and has been instrumental in keeping our community safe. Shawn, you've been very involved with gun violence issues for years. Can you give us some background on the scope of gun violence as a health pandemic generally and the state of the law in Pennsylvania?
Sure. Gun violence is a significant health issue in the United States. We lose about 40,000 Americans per year to gun deaths. That's on par with the number of people that we lose to car accidents. We also have about 70,000 or more people per year that are victims of non-lethal gun injuries, some often disabling gun injuries. So it affects many people across the Commonwealth and across the United States. We pay about $12 billion a year as taxpayers to cover medical and criminal justice costs related to gun violence. So it costs all of us. About 2/3 of those who die by firearm die by suicide. The other third are homicides, and a small number of those are accidental injuries. About 100 children per year die by accidentally discharging a firearm at home. In Pennsylvania, we lose about 1,600 people per year to firearm death. Again, 2/3 are suicides and a third are homicides. Gun violence is distributed pretty equally across the Commonwealth. In urban areas, homicide rates are higher. In suburban and rural areas, suicide rates are higher. But the overall toll of gun violence is it's a pretty standard rate across the region. In terms of our gun laws in Pennsylvania, we do have a good background check system. Almost all gun purchases need to go through a background check. And if you are a prohibited purchaser, meaning that you have a felony conviction, some violent misdemeanors, or have a protection from abuse order against you, or have ever been involuntarily committed to a psychiatric facility for evaluation, you can't legally purchase a firearm in Pennsylvania. We also require a permit that you can apply to your sheriff's office to get if you want to carry a firearm concealed. We don't have the ability to just carry them concealed without that permit. In Pennsylvania, we don't require a license to own a gun unless you're going to carry that gun in a concealed way. We don't require you to register your guns. There's no waiting period on purchases. There's no limits on guns or ammunition purchases. There's no law requiring safe storage. There's no requirement to report your gun lost or stolen if it is in fact lost or stolen. And in the United States, in Pennsylvania, people are able to carry a firearm openly. If they're not concealing it, they don't need any permit to do so. So that's a brief overview of our laws.
Well, thank you so much. Superintendent McGrath, can you tell us what based on your experience, what the issue with gun violence has been in Lower Merion Township during the last 5 years?
Sure, to focus more locally on this. In terms of suicide, for the last 5 years, we've investigated 19, 3 involved firearms. We've had 3 homicides over that same 5-year period, and 2 of those involve firearms. We've had 7 assaults that involve firearms, 35 armed robberies. And fortunately, it's a problem that happens around the country. There's accidents related to firearms. Typically, it's not ill intent involved, just accidents. We've had zero, fortunately. But that is another consideration when people talk about having firearms in their household.
Are firearms common in Lower Merion Township?
Well, there's no requirement for people to report what they own, and that number isn't actually been able to be verified. But the statistics are there's about 393 million firearms in the United States. Through a voluntary survey, about 1/3 of U.S. Adults report owning a firearm, and maybe more than one. So I think Lower Merion would certainly fall into that same number.
In terms of safety issues, what kinds of programs does the township offer to help keep our residents safe?
Well, we do have cable locks for anybody in the township if they'd like to get one from the police department. They are available. You can stop in or call our staff and inspections unit at 610-645-6250. We also have turn-in events, which we run along with the district attorney's office of Montgomery County. And they run it at multiple locations around the county at least once a year. So that's an opportunity for people who have weapons they no longer want in their household to bring them in and safely have them disposed of. We also can run specialized presentations to people about gun safety for whether it's a neighborhood club, a civic, anybody who requests that.
Well, thank you so much. I'm sorry I'm going to have to interrupt the conversation, but we have to take a break. We'll be back with more on gun violence on Health Matters. Stay tuned. Welcome back to Health Matters. I'm your host, Gilda Kramer. We're talking about gun violence, a health pandemic. Joining me is Dr. Joshua Marks, an associate professor of surgery in the Division of Acute Care Surgery, Trauma, Surgical Critical Care, and Emergency General Surgery at Thomas Jefferson University. He is an attending trauma surgeon at Thomas Jefferson University Hospital and Mainline Health. He's also associate director of the Jefferson Center for Injury Research and Prevention. He is board certified in surgery and surgical critical care and as a fellow of the American College of Surgeons. He grew up and currently lives in the township and obtained his start in medicine in high school as an EMT with Narberth Ambulance, where he remains a life member. Dr. Marks, can you tell us how most of the gunshot injuries that you treat happen?
Well, thank you, Commissioner Kramer, for the invitation and the privilege of talking about this very important public health pandemic. We see a lot of patients that come in, unfortunately, as victims of gun violence. There are those that come in that they're intentional, there's unintentional. We know there's lawful and unlawful use of handguns and weapons that cause injury. I like to say that there is nobody who wakes up in the morning and expects to land in the trauma center and need our care, no matter what walk of life they're from or what it is that is going on in their life that needs our care, but we're there for them. We recognize that we heard in the first segment, there are those that are attempting suicide as an ultimate call for help, and we recognize that it's a call for help, so our efforts are to save them and not only provide the physical rehabilitation that they need, but also the mental services that they need that we talked about in the first segment, and we'll talk about some more. And then there are those that are victims of violent events. I'll tell you anecdotally, in my experience, there tend to be fewer true random acts of violence. There are often some circumstances surrounding the incident, but there are always innocent victims, and whatever the story is behind isn't important to us in the moment. We work hard to save every life that presents to our trauma centers and make an effort to stop the bleeding and restore function and get people back to how they were pre-injury.
How do gunshots affect a victim's body?
Certainly, so that it's a high projectile force that is entering the body. Our job, my job as a surgeon, is to stop bleeding, and the way we do that is I, simply try and line up whatever holes the projectiles, the bullets may have occurred and may have caused, determine the trajectory and fix, really as a race against time. Can I stop the bleeding and sew up the holes before the patient maybe bleeds to death? So lining that up, the trajectory to determine injury and fix it is our goal. Depending on where you're shot, depends on the injury. And certainly the more gunshots that a single person sustains, the more bullets that pierce their body and the different cavities, different parts of their body, the more challenging that it can be and the more severely injured the patient might be.
Are there special issues in recovery from gunshot wounds?
Absolutely. There's the physical recovery from the surgery that the patient has had, but there's also the emotional recovery and the rehabilitation that the patient may need. Frequently, after we get somebody through the physical hurt, through the mending process, we'll hear them talking about reliving the moment of whatever event caused them to be in the hospital. And part of their rehab is not only that physical rehab of gaining their strength back, eating again, walking, participating in their activities of daily living, but also the mental rehabilitation, not only for those that we talked about that might be a suicide attempt, but just those reliving that violent event in their life. The sounds, the sights that they may have, and helping them psychologically as well as physically.
Do you treat children as well, or do they go to a different hospital?
So the centers where I work pretty much deal with adults, however, have treated children, and sometimes patients are brought to the closest available trauma center, and we will stabilize and transfer. We're very fortunate to have Children's Hospital of Philadelphia in our region, so to transfer there, but after we've stabilized. Certainly some of the most tragic stories and experience I've had have been childhood victims of gun violence. They're certainly the accidental ones are tragic. The intentional are really equally tragic and horrible stories. So I have unfortunately witnessed that. It never gets easy.
Have you, in your practice, seen the effect of gun violence on families and family dynamics?
Certainly. So one of the toughest parts of the job, usually say surgery is easy. You can learn that and it's a skill. It's talking to families afterwards. Certainly, if the patient survives, that's an easier conversation, even though there might be a long road ahead. But the conversation with a family after just pronouncing one of their loved ones deceased is the hardest part of the job. I have had very challenging, difficult, and emotionally moving encounters with family members. I think one of the things related to that is also, unfortunately, we see patients who are repeat victims of gun violence, and trauma recidivism or repeat offenders, repeat victims, makes the job even more challenging. It's even a harder element of this pandemic that there are those that aren't only a victim once, but become victims sometimes multiple times over, which really echoes that this is a pandemic that needs a solution.
Would responsible gun ownership and gun safety help to avoid some of these tragedies?
Certainly there needs to be more done, and what, as we heard in the first segment, some of our laws have prohibited us from doing the necessary research to figure out what are the elements that will help us control this pandemic. That fortunately has those laws have loosened and allowed us to start doing the necessary epidemiologic research that we need to do to understand the full aspects and full impact of this pandemic. And that's some of the work we're doing. The Jefferson Center for Injury Research Prevention is beginning to work on that collaboration and sharing of data across different venues, healthcare, law enforcement, public health, to really come up with what is the comprehensive solution to this pandemic.
Thank you so much. We are going to have to take another break, and we'll be right back with more on gun violence on Health Matters. Stay tuned. Welcome back to Health Matters. I'm your host, Gilda Kramer. We've been talking about gun violence and its effect on people's lives. Now we'd like to talk about responsible gun ownership and gun safety. With me today are Michael McGrath, Superintendent of the Police of the Lower Merion Township, Shawn Kramer, a licensed professional counselor with the Center for Psychological Services in Lower Merion, and Dr. Joshua Mark, a trauma surgeon at Thomas Jefferson University Hospital and Mainline Health. We talked earlier about some of the programs that the township has to promote responsible gun ownership and gun safety, like gun locks and programs to turn in guns. Superintendent McGrath, what's the best way for people to turn in guns that they don't want to have in their home?
Well, there are two ways. We have people who just bring them to the police department and turn them in. So we just have them sign them over, say they want to be responsibly disposed of, and we'll take them off their hands. And if they prefer just to be at home and give us a call, tell us that they have a firearm in the household, they no longer have the need for it. Frequently we'll have a situation where a gun is passed down through the family and circumstances change and people want to get rid of the firearm. So they can call us, we'll come out and secure the weapon and take care of its proper disposal.
What safety precautions should people take when someone in the home is mentally unstable and there are guns in the home?
Well, it was mentioned earlier in the program that if somebody is involuntarily committed, firearms can be removed from the home. In order for anybody, whether it's that or a domestic incident or some other similar matter, to get them back, most cases involves some type of court hearing. A judge gets involved before guns are released back to that person or a household. So under Pennsylvania laws, if there's firearms related to a domestic matter, they can be removed from the home.
And I might add to what Superintendent McGrath is saying, is that sometimes people can be at risk for suicide, but they haven't been involuntarily committed. And so family members may see that the person is at risk. Maybe they're not ready to go into treatment yet, and it's not, they can't be compelled to treatment at that point, but family members want to keep everybody safe. They can, you might consider either temporarily removing the firearm from the home to keep everybody safe, and use a procedure like Superintendent McGrath said, to have the gun removed, or bring them to the home of someone else who's, who's not a prohibited holder of guns, to hold on to them, keep them out of the home of the person who's at risk. Secondly, if you can't do that, we recommend that you store your guns safely. So unloaded with ammunition stored, locked, and separately from the firearm, which should also be locked. Anytime you can put between the person who's at risk and the firearm is protective against anybody getting hurt.
What other actions do you recommend that responsible gun owners take to prevent gun violence? Are there issues in terms of, securing guns so that children can't get to them, teaching your children and, courses that might be available to take?
Mhm. Yeah, we recommend at ceasefire PI, we always recommend that people lock up any firearms that they have at home, and really weigh the risk against the benefits of whether it's going to be advisable for you to have a firearm in the home. Many people want that for home defense. Do your homework. There are risks as well as benefits to that, and having a firearm in the home does increase the risk of suicide in the home by a factor of 3. So really think about what you're doing before you bring it into your home, and be sure that you know how to handle it safely. And then I would turn it over to Superintendent McGrath if he has any other recommendations.
Yeah, a survey showed that about 63% of the people cited their own home security for having a firearm. Another 40% was for hunting. So whatever reason you might have the firearm in your household, it is very important that it be properly secured. We've already noted the different things you should do, whether it's putting it in a safe, a lock safe, putting a cable lock around the gun itself, being unloaded. Those are important things to do. A couple of other things to remember about a firearm. When you're taking it out, whether you're going hunting, whether you're moving it around the house, taking it to a firearms range, never ever put your finger on a trigger of any firearm unless you're intending to shoot it. And a lot of people, that's where accidents occur because they're not properly handling that firearm. And then lastly, please, if you're going to be a gun owner, be a responsible gun owner, and take a training course. It's a deadly weapon. It can be. So we take training courses for things that are much easier and simpler to use. Why not take one for a firearm?
What resources do we have available in the township in domestic violence and mental health situations to try to avoid having gun violence?
Mm-hmm. Yeah, we have a variety of resources here in the county and nationally, and I know that we'll be posting those phone numbers for domestic violence intervention as well as suicide. But I would just give one plug for family. If anybody in the family, you're worried about anybody in the family and whether they're at risk for suicide, go to the Suicide Prevention Lifeline website, learn about risk factors for suicide, and then talk to your family member. That goes a long way. Usually when someone is at risk, family members have a funny feeling and they can, that intervention and that care can really go a long way.
Now, I would just add that every Lower Merion police officer is trained through the county programs for crisis intervention. And they get extensive training to be able to address mental health issues. So that is something that people should be comfortable about, that their police force has that training.
Do you have any other advice to promote gun safety and the pandemic of gun violence?
I would say if you care about this, if you want to see a reduction in gun violence, do research, do your homework, talk to policymakers about the things that you want to see them do to make, all of us safer.
That's all we have time for on this month's show. I want to thank my guests, Shawn Kramer, Superintendent Mike McGrath, and Dr. Joshua Marks for being here and sharing their experience and wisdom. I'm Gilda Kramer, and I'll see you next time on Health.